cover some best practices. I'll let you know, get a little prelude going into it. We gathered a lot of research, so we reached out to a lot of resources because there was really nothing directly and specifically pointed at swimming pools. With that being said, it really comes down to that local establishment, that local authority area that you really want to check with and go through things. But we'll kick it off right here. I'll share my screen and then we'll get going. And just want to make sure everyone sees COVID-19 pool safety and my cursor.
Yes, we can see.
Excellent. Okay. So as I was saying, we've gone through many resources and pulled a lot of information together to present this. We had it in place early on our website, and of course we welcome the opportunity to share it with CFHLA members on this Zoom call. So there we go. We'll go right into it here. So I'll give a quick overview. So presentation overview. So what we'll do, we'll go over the Florida Phase 2 reopening, going over some of those parameters that they presented to us. And we'll move into CDC COVID-19 guidelines for pools. Although there's not a direct specific setup for it, there is information that's been given in regards to pools, and we'll associate that with the rest of the CDC code and what they're recommending. And of course, we'll go into our safety recommendations and then communication and summary. And as Kim stated, of course, the presentation will be available for download after the meeting. I think Kim's going to be handling that and getting it all out to you, to all members. All right, so Florida Phase 2 reopening. The following recommendations are provided by the state of Florida. So these are all in accordance with the guidance from CDC. Obviously, as we've heard over and over, face masks are recommended. And I want to be clear when we say this, that face masks are recommended on the pool deck in regards to pools, not in the pool. Of course, you do not wear the masks in the water. Open businesses should follow the appropriate social distancing rules, of course, and sanitation measures, and limit groups to 10 people, no more than 10 people. And we can't stress it enough, but you really need to look or dive into your local guidance and follow that local guidance, because this is not something that is just a mandate over federally or state across the board. Although there's some guidance given, it really comes down to that local guidance that really kind of puts you in the right direction. Okay. Sorry about that. My mouse is getting a little crazy on me, so it's jumping ahead of me. Business responsibility. So if you do decide to reopen your pools, and there are many properties that haven't, and those properties that are not reopening their pools, of course, you still want to maintain that body of water. So we don't want to just obviously let it go. We need to sanitize and balance and make sure it's in order. But if we do decide to reopen pools, make sure that their procedures, definitely have some procedures in place to help both the employees and the patrons be safe. So our recommendations today are based on information published by CDC and the state of Florida. So we're going to choose to implement anything that makes sense for your location. Really, a lot of this stuff comes down to a common sense factor where it just makes sense. As Rich was saying, when you definitely have a party on a pool deck and nobody's following the social distancing rules or the masks, it doesn't make sense, not in this time. We need to grasp hold of that and use common sense in those situations. Again, referring to the being on the pool deck. So according to CDC, and this is important, and we've actually put this out at Poolsure. We put this out very early on in going through it. And according to the CDC, there is absolutely no evidence that COVID-19 virus can be spread to humans through use of properly disinfected pools and spas. So what does that mean? As we would say, of course, in our business, we want everybody in the pool. Right now, I guess everybody should be in the swimming pool, right? Because you can't transfer this virus in a properly sanitized pool. And I stress those quote unquote properly sanitized and disinfected pool. This means that that COVID cannot spread through the water if it is disinfected. Now there's more to just throwing some chlorine in the water for it to be disinfected. And I will, if I get too high on my soapbox, because I am an instructor, we'll just kick it out from under me and we'll get back to normal before I put you all to sleep. We're talking about ORP and pH and the relevance of everything. But there is some, I'll drop a little bit in there so we can go through that. Swimming is a safe activity if pool management is proactive about pool sanitation. So the actual swimming portion of this all comes down to a properly sanitized and disinfected pool. And of course, everybody really is interested in the on deck and the social distancing and what happens outside the pool. And we all know too, when you're in a pool, you're not trying to go up to people you don't know. You're not, you're in your bathing suits. It's not something where you're actually, mingling with everybody. You are keeping kind of a social distance. But you'll probably want to put something in place from a number standpoint of the pool. So if your bathing limit was 25, you cut that in half, and we're gonna go into that a little bit here coming up. So real quick, so everyone, we got a little video for you. So we'll run the video, and then we'll continue on through the presentation, and then we'll open up for questions, of course, when we're done. But I'm just going to go ahead and click this video so everyone can follow in. But this is the coronavirus disease 2019 regarding swimming pools.
Looking to make a splash this summer? CDC has information for those who operate or manage public pools, hot tubs, and water playgrounds to help prevent the spread of COVID-19. Consider the following tips. Urge staff and patrons to stay home if they are sick. Promote healthy behaviors, such as frequent hand washing, covering coughs and sneezes, and using a cloth face covering when not in the water. Do not place cloth face coverings on children under age 2 or on anyone who has trouble breathing or is unconscious, weak, or otherwise unable to remove the cover without help. Make sure staff and patrons have enough supplies, such as soap for hand washing stations, paper towels, no-touch trash cans, and hand sanitizer with at least 60% alcohol. Clean and disinfect equipment and pool toys between use. This includes handrails, slides, lounge chairs, tabletops, pool noodles, and door handles. Remind people not to share items that are personal or difficult to clean after each use, such as towels, goggles, and snorkels. For any indoor spaces, increase airflow by opening doors and windows when safe and possible. Consider limiting number of people at the pool or venue so people can stay 6 feet apart from those they do not live with. Encourage social distancing by changing deck layouts, moving tables, or by using visual cues like tape on decks to make sure people can stay 6 feet apart. Limit large group events in and out of the water where social distancing cannot be maintained. Stagger drop-offs and pickups. Rotate staff shifts if possible, and remind staff to practice social distancing with each other and patrons. Create a plan in case someone gets sick. The plan should include how to isolate and transport those who are sick to a healthcare provider. Work with local health officials to develop this plan. Post signs and posters, make announcements over the PA systems, and include messages in emails and social media to promote healthy behaviors. You can help people have fun and be safe. Find other considerations for aquatic venues at the link on the screen, or dive into more information at cdc.gov/coronavirus.
Okay, so a lot of common sense as we go through the video and looking at those things, but some key points, of course, limiting the number of people in the body of water, which is going to limit the number of people at the pool deck, and the social distancing on the pool deck. Just as we see, the tape at the 7-Elevens or the grocery stores or Home Depot or Lowe's, sectioning out the people waiting in queues or lines. You want to do the same thing on the pool deck. So you want to have that separation of those chairs, so limit the number of chairs and have that space in between your guests. So quickly to recap. So again, of course, urge staff and guests to stay home if they're feeling sick. I think that's pretty commonsensical. I mean, obviously, if they're showing any signs, you do not want them out to spread the virus. Encourage social distancing by limiting the pool capacity, as we just said. Promote healthy behaviors such as hand washing and masks or mask usage. And I do want to bring up this point again with that asterisk there. We don't want children under the age of 2 with masks. You do not want to put a mask on a child under the age of 2, or those who can't remove a covering without help. Just because if they're having trouble breathing, it's going to limit their oxygen intake. It could be an issue. I have seen that where I've seen small children with masks, and I always stop and make a recommendation that that is not what we want to do right now. Obviously, it's very important to clean and disinfect all equipment and pool toys in between usage. And the disinfectants, as we've gone over from the very beginning, I mean, your standard disinfectants, your Clorox sprays, your anything from a chlorine or bleach type standpoint, is this virus can't hold up to at all. It doesn't take a lot, but it just takes the effort of doing it. Remind patrons about healthy behaviors through emails, PA announcements, and handouts, of course. The communication is huge, making sure everyone knows it. I think the big thing, sometimes it'll start to fall on, fall on deaf ears, because it's said so much, but then again, we can't say it enough. That's the driving factor. We have to get that message out over and over and over again. So provide staff and guest sanitation supplies. So obviously making sure you have plenty of hand washing soap, paper towels, garbage cans, hand sanitizers with at least 60% alcohol. That's the big thing. And then create a COVID response plan. How to isolate a person with symptoms, if you have one on the deck. Who to call when needed. What hospital is closest to clinic. How to transport that person from the pool area to the response center. And actually what's not on here is what to do with that pool area then after that. So if you have someone in the area that is showing those symptoms, what should your protocol be at that point? Obviously, we want to be closing the pool at that point in order to prevent that spread. And that's just temporarily, of course, until it's sanitized and open again. How is COVID spread in pools? Okay. According to the CDC, COVID is spread through respiratory droplets, as we've all heard. In pool areas, transmissions can occur between people who are not practicing the recommended 6 feet social distancing, number one, and through inhaling respiratory droplets produced by an infected person while coughing or sneezing. So, if someone projects. And then if the pool is not properly sanitized or disinfected, the virus is not effectively deactivated. And this is where, again, I'll try to prevent from getting on my instructor soapbox, but this is where we really need to pay close attention to is that sanitation, that proper balance of that pool water, so it can prevent that virus from spreading. So you can promote social distancing practices during the pool use. So we consider setting up an appointment system. So a lot of my clients are instituting that reservation system. So they'll have your signups, right? So they'll come in and residents or guests can come in for 2 hours and they have it booked. And then after that 2 hours, they exit and then coming back, the staff would come back in and disinfect the entire pool deck for maybe that half hour or 15 minutes, however big your pool is or small your pool is, depends on that. And then you bring your second reservation in for 2 hours, if that be the case. And it could be 1 hour. It could entirely up to how your setting warrants. You want to rearrange the pool furniture to accommodate 6 feet of separation between individuals. Like I said, putting tape on decks, and you can get creative with that. You know, you can make it look good. You can put something in the middle, like oh not here, you know, or whatever the case may be. But having those stickers, those placards on the deck is going to be a big thing. And of course, you limit that pool furniture. Providing pool towels on an individual basis, either by leaving them in rooms, so they're specific to that guest, or setting up minimal touch distribution system. And discourage, of course, sharing of pool equipment or toys. We don't want to be doing that. I do want to throw this out here. With the closings, the theme parks being closed, we saw this real early on in COVID when it hit. When the theme parks closed, of course, all of you still had guests, a lot of guests that were still here in town and still booked and were there. So theme parks closed, restaurants closed, but we still have the guests at the hotels. And I imagine where you all saw your gathering of people were at the pools really quickly, because that was really their outlet, right? That was, they flew here from Idaho or Ohio or wherever they came from, and now the theme park is closed. So God darn it, we're going to use the pool, right? So they're gonna jump in. So that's still going to be there, and through this second phase or whatever we have in the future here coming up, that's still going to be the case. Your people that have booked, even though it is lower, a lot lower now, the people that have booked, if anything happens or the theme park closes, you're going to have that same flux of people that want to use the pools. So we'll need to be prepared for that, of course, and you'll need to be prepared for that. We want to clean the pool areas thoroughly. Obviously, we clean and disinfect pool shower areas, bathrooms between each group visit. So if you're doing a reservation system, then obviously that's what you're going to be doing in between those reservations. If you're not scheduling pool appointments, then clean and disinfect at preset intervals throughout the day. So just have it set for if it's every 20 minutes, if it's every 30 minutes, or however you see fit for your operation. Close the pool when maintenance staff is cleaning and disinfecting. Of course, we don't want to be spraying down the guests with bleach. That wouldn't be a good thing. And then, of course, provide masks to pool patrons. Encourage masks to be worn when not actively swimming. And we do not, of course, want to wear masks while we're in the body of water. Now, here's where we want to make sure we keep very, very close eye on this. Proper disinfection of pool water happens when chemicals are evenly distributed through the pool. We want to ensure that the pool sanitation chemicals, the bleach and the acid, are well stocked, number one, because the last thing you want to do is run out of bleach or run out of acid. And I'm going to explain how the acid really plays into this, because it's huge in regards to disinfection and sanitation. You need to check daily that the pool circulation and filtration systems are functioning at 100%. So whereas before, if you had a protocol for your maintenance staff to check 3 times a day, you obviously need to double that up, right? So they need to be there 6 times a day or even more, depending on how you guys facilitate. Proper testing of that water is going to be crucial. Using a spin touch or a DPD test to manually test your pool water at least once per day. And if I were in your shoes, of course, I'd be testing even more than that during this time. But we are still under a guideline testing once per day, but use a very good testing apparatus for getting accurate measurements. And ensure that the free available chlorine, or FAC, and the pH levels are in range. Now here's a key. And again, I'll be careful not to get too high on my soapbox here, but acceptable chemistry ranges. Now your pH between 7.2 and 7.8, and your free available chlorine is still between 1 part per million and 10 part per million. If you remember, I said before, it doesn't take a lot of chlorine to kill this virus or kill other bugs in the swimming pool. It doesn't take a lot. When, here's a key, when your pH is in line. When this pH gets out of line, if it goes high, if it's up above, it's 7, 8, 9, 8.0, we drastically limit the disinfection and sanitation factors of this chlorine that's in the water. And I've always held the opinion that you want to keep your pH a little lower. You want, not lower than 7.2, of course, but you want to keep it on the lower side of this range. Because when you have a lower pH, a 7.2, 3, or 4, you have a much more active sanitation, you have much more active chlorine for sanitation and disinfection. So it's not a matter of just running 10 part per million, because you could be running 10 part per million and have an 8.0 pH, which really is not offering the proper disinfection and sanitation that's needed to kill this virus. So this is a key point to remember. And when you're talking to your maintenance staff, this is something you want to let them know. And I'm sure they probably already do. They're probably CPO certified or AFO certified. But keeping it a little lower pH right now, especially today, would probably be a very good idea, because you're going to have more potency on your sanitation and disinfection. Okay, I'm done with my class on that, so I won't bore you anymore on that. If we have questions afterward, of course, feel free to ask. So communicate guidelines to guests. Communicating your guidelines is just as important as creating your guidelines. And we can have all the protocols in place, but if your guests don't know it, then of course it's not really doing a whole lot of good. Post your pool safety notices along with other safety notices on a hotel's website. A checklist of safety guidelines might be helpful for guests. During check-in, inform guests about the pool safety precautions. And I'm sure the majority of you are probably already doing all this, but provide a copy of safety guidelines in each room. Discard and replace after checkout. So having it sitting on the towels, on the pool towels, on the bed when they come in, that kind of thing. But the communication is big. All right, so I'll surmise here real quickly, and then we can open it up. I'll kick it back to Kim, and then we can open it up for questions. I'm not sure exactly how that was going to roll out, or if we're going to have the commentaries first. So number one, create safety procedures for pool use and keep employees and guests safe. And this is important, because we could have that second influx where people are going to be using your bodies of water a lot more, because say a theme park closes tomorrow. So just be prepared for that. We want to follow the CDC guidelines when designing your safety procedures, just as we did here. And we gathered this from a lot of different research. Encourage all guests and employees to maintain 6 feet of social distancing at all times. Make sure that your pool area can accommodate 6 feet of social distancing at all times. Simply put, remove the number of chairs, or remove a certain number of chairs that are on your deck and set it up so it is socially distanced. Distanced. Is that even a word? Keep pool areas clean and disinfect any shared equipment after use. So if you do use a reservation system, in between those reservations, those are the times that your maintenance staff want to get out there and do a full disinfection of the entire area. Allow pool water to disinfect by allowing for efficient filtration, circulation, and chemical treatment. Going back to what I was saying before about the pH and the chlorine, all that's great, and maintaining that is great, but if you don't have proper filtration, so your filters are backed up or not clean, that means you don't have proper circulation, which means you will not have proper chemical treatment, and you're opening yourself up even in the pool for a transfer of that virus. So filtration and circulation are very, very important. And then lastly, communicate your safety guidelines to guests clearly and often. Can't do it often enough, and it's got to be clear and concise. And everywhere they turn, they do need to see that, so they know exactly how to handle themselves at that body of water. That being said, that is the end of my presentation. And of course, you'll have a copy of this, and there are some links on here as well that you'll be able to go to, and you can go ahead and check check on all these when you receive the presentation. With that being said, I will stop my sharing of my screen and then open it up and kick it back to you, Kim, and we can take it to the next movement here.
Great. Thank you so much, Chris. Lots of good information. So before we go to our brief Q&A at the end, I'm going to turn it over to our panel. So first up, we have Joe Cardone, who is the general manager over at the Doubletree SeaWorld. So what are your protocols over there, Joe?
Good morning, everybody. Thank you, Kim. Appreciate the time. Of course, we want to keep committed to the well-being of our guests and team members. So it starts with signage, starts with, as mentioned, the chair spacing. Keep that six foot social distancing. And, that means you have to remove some lounge chairs. So we have to keep everybody safe. Some of the things that, and again, this could be a little bit repetitive. Chris did such a fantastic job with his presentation, but, from a hotel standpoint, we used to clean behind the scenes, and I think our guests are now expecting us to clean in front of them to show that we are actually cleaning. So, disinfecting cleaner was something that we would hide or we would have folks do before folks came. So we were kind of on stage. Now that's part of the show. We have to have folks on a regular basis walking through and cleaning. So, I know, Chris, you're jumping in there, and that's a part of the thing now is besides the lobby and the front desk, the pool area, there's an expectation that somebody is between folks staying in there or between before folks get there, that every hour or two we have someone going there and wiping out all the hard surfaces, restaurant areas, tables. That's an expectation that I don't think is going to change anytime soon. So I think that's one big thing for us. I think another thing is that our pool attendants, and again, this is something that was mentioned, but we have them testing the water now in front of guests, where before that was something that Chris probably would tell you was done before we put the big show on, before we opened and they were doing the pool cleaning. Now it's something that we do in front of guests so they can see that 1 or 2 times during the time that a guest would be there, we're testing the pool, and the folks can see that we're doing that. So we're showing them we're taking something like that seriously. A third thing is the hand sanitizer stations. We have them via the outlets outside, as well as by where our pool bathrooms are right outside there. So making sure we have plenty of hand sanitizer stations. I think also Chris mentioned, but after a family or a group leaves the pool, re-spreading the chairs. Okay, we know, and we're not stopping families from having a good time, right? We want them to have a good time. So they will inevitably, families will put chairs together, right? We have our signs out, we have all the social distancing, but the reality is folks that are families are pulling chairs together. I think we'd all agree that that's okay. But when that group departs, there's an alert that with our staff that everyone has to re-spread those chairs and make sure that we're wiping down everything and getting ready for our next guests to come up. So again, displaying that signage related to social distancing in and around the pool is an important part. Again, I don't want to take too much from everybody else, but those were just kind of those 4 or 5 items that we're doing at our hotel.
If I could add to that, Joe, I think that is absolutely perfect. I mean, when we talk about disinfecting when the guests are not there, we didn't mention in the presentation about disinfecting while they are there, and those minor little movements are fantastic for the guests to see. So I commend you for that. That's exactly what you should be doing. Testing the water in front of them as well. I think it's perfect. I think that's definitely the way to go about it. And the full disinfection of that area would take place, of course, in between reservations if you did. How you're doing it specifically, I think it's great.
Thanks.
It's great for you to see exactly what's happening. So thank you, Joe. Next, we have Mike Magnelli, with General Manager with the Las Palmeras Hilton Grand Vacations.
Hello, everybody. And great commentary, Chris and Joe. You know, much of the same at Hilton Grand Vacations. It's you know, hard to believe we've been now reopened since you know, May, that we came back together and wrote a number of new SOPs, and a big one was a new SOP on the pool operation. We, you know, really looked at 4, you know, key things. We looked at the pool deck setup, you know, as you've heard from Chris and Joe. We looked at our towel distribution program. We looked at the hours of operation, and then we looked at our recreation program. For those of you that know, on the timeshare side, we have a full recreation program with recreation attendants. We did not open our activity centers on site, but we thought a good program for us would be a wonderful pool ambassador program, you know, to really take a look at, you know, how we're distributing the towels and then really disinfecting, you know, over the hours of the operation. So the setup itself, you know, as you've heard, you know, we went ahead and looked at the total capacity on the pool deck. It's been reduced 50%. We've got 100 lounge chairs now on our pool deck that are spaced out. A guest or an owner would come to the pool, and our pool ambassador would greet them and have full PPE on, face covering, gloves, and escort them over to a set of lounge chairs. So, and we grouped the lounge chairs into 2, 4, 6, and then depending on the size of the family, we would put them in a certain area of the pool deck. And with our occupancy right now, it's been very easy to be able to keep everybody apart. So the hours of operation we've reduced in order to deep clean at the end of the day, and then to open up with deep cleaning. The Pool Ambassador program, it's working really well. We had it set up right at the entrance originally to the pool area, but then when the second closure came in for for bars and to limit bars, we never reopened our pool bar. So we thought, why don't we just repurpose our pool bar? For those of you that have been on site at Las Palmeras, we took the pool bar, removed all the liquor, and removed a bar setup, and we basically invited our pool ambassador and our recreation team to work from that space to create a recreation center. So then our guests could walk up. We would have somebody meet and greet. We would do a distribution of the towels so nobody else is touching their towel. And then we would escort them over to the lounge chair, an area where they could be as a family. So that has been actually working out well. We fully have the ability now to sell all of our recreation items. And then we have a non-alcoholic beverage program and a snack program that is very easy to be able to run. So we just really rethought of how we were set up before in a full service environment, and then changed it to, you know, more of a limited service and more of a distancing type of environment, you know, on site at the resort. So we're constantly cleaning all the top 10 touch points, all the entry points, all the door handles. That is happening throughout the day by the pool ambassador. So we run with 2 ambassadors on site at the resort, and that's been actually working out very well. So I'll go ahead and stop. Thank you so much, everybody.
Thanks, Mike. That's great. The pool ambassador sounds like a wonderful idea, and it sounds like the guests are really, really liking that. So our final panelist today is John McGavin, Area General Manager at the Grand Lakes Orlando. I'll turn it over to you, John.
Thanks, Kim, and Joe and Mike. I think you covered probably 95% of the items. And we have 2 hotels at Grand Lakes. We have the Ritz-Carlton and the JW Marriott. You know, I say the first thing we did is we actually took pool chairs. I think Mike had mentioned this as well. We reduced from 900 chairs at the JW to 600 and 500 to 350 at the Ritz-Carlton. And I'm sure most hoteliers in the market are experiencing the same thing, is that our guests are coming to the hotels and so far they haven't left. So they really spend the majority of their time at the pool. Similar to what Mike had mentioned, we control the entrances to the pool and have just one entrance, and we treat it like a restaurant. We have someone who's there taking the guest name. We put a band around their arm. We take them to their pool chairs, and we, you know, on the weekends we restrict. You know, I would say we restrict, but we try to keep our guests to two chairs per. And of course, that's wishful thinking because like Joe and Mike had mentioned, families are with them. So we typically, they end up in a cluster. We've actually taken individuals, we've actually put them in white uniforms, and their sole purpose is to be very, very visible. And they're with the, so whether it's, we have individuals in the hotels as well as out of the pools, and their sole purpose is basically they walk around with sanitizing solution. If a guest gets up, once the chair is cleaned, they squirt off the chair with the peroxide, or if it's in the guest restrooms at the pool, if it's the trash bins or the towel dispensers or whatever it is, but it's the same visibly cleaning. We've also added additional safety and security, loss prevention, as well as managers out at the pool. And that's just, whenever you get out, we have pool bars at our hotels, and it's amazing that people follow the protocols and wearing a mask and social distancing until they get a couple cocktails in, then all of a sudden everything just goes to the wayside. So adding a little bit of extra presence there. And then I'd say that the only other thing I'd add is we're doing a lot of role playing, and it's just, how do you address certain situations with guests, whether it's someone who doesn't want to wear PPE, someone who doesn't want to social distance, someone who might be impacting negatively another guest's enjoyment around the pool. So we do spend quite a bit of time on that, and that's really it for me.
That's great stuff.
All right, thank you, John. No, that's great. The idea of role playing, I think, is really important too, because there's a lot of people out there that don't necessarily want to follow the rules, so you need to make sure that you're handling it properly. So thank you so much, John, and thank you, Mike and Joe. I appreciate you both being on here, and we're going to open up for questions now, if anybody has any.
None? Zero?
Wow, you all did such a good job. Nobody has any questions.
I'll add a point to Joe, Mike, and John's comments, because the ideas, and this, maybe we'll get it open to questions, but the comments of cleaning during guest viewing, I think it's perfect, Joe. I think that's exactly what should be happening. Full ambassador idea, Mike. Spot on. I mean, that's exactly what should be done, and that gives that appearance and that feeling and that safety to your guests. So they know that you got it under control. And John, you're talking about employees in white uniforms and role playing. I'd like all your guys' permission if I could actually add these to our presentation, to be honest with you, because I think it's fantastic. Those are fantastic ideas. I think they're spot on, and it creates a sense of safety for your patrons and for your guests. And again, I do think you'll see more activity at your pools because of what's happening now again, because there's going to be less other things to do. So, but yeah, kudos. Awesome stuff. But yeah, questions, anybody?
Nope. All right. I don't think we have any questions. So with that, we'll end the seminar. Thank you all so much for being on here, and we appreciate you, Chris, and Mike and Joe and John, for everything that you shared. Again, I will be sending out the PowerPoint presentation later on today, and of course this recording will be available on our YouTube page for you to share with your team. So if you do have any further questions for Chris, his information is on that presentation, or you can always send me an email and I will forward you his information. With that, everybody have a wonderful Friday and a great weekend. Thank you all.
You too. Thanks, Kim.
Thank you.
Bye.
Thanks, Kim.